if you don't know anything about this, it sounds great, right? Oh, we're just going to put this in. You're not going to get pregnant. You're not going to get your period. Okay, cool. Sign me up.
So welcome to the TRT and Hormone Optimization YouTube channel. And back with us as a guest is Dr. Amy Wecker. Welcome back, Amy.
Hi, thanks for having me back.
Hi, very welcome. So today let's talk about anti-conceptive, as we call it. You call it contraceptive methods, especially female, I guess, because for males there aren't too many options. So it's especially relevant for a lot of women, older and younger, even teenagers. I know a lot of young girls nowadays that get onto these hormonal or contraceptive pills. So let's talk about that. Maybe let's start off with the pills. I guess those are most popular first.
Yeah, so this is actually a topic that I was really excited to talk about because it's really one of the big problems like conundrums, right? Because all of the different birth control options, like the pills, the NuvaRing, the injections, the IUDs, all this kind of stuff. These are synthetic hormones, okay, which we know that synthetic hormones are bad for you, but also if you really, really, really don't want to get pregnant, then you have to do something, right?
Yeah.
So it's a big conundrum, and it's something that we talk a lot about in the anti-aging world because every lecture I go to, everyone is always saying, "Oh, don't take birth control pills. Don't take birth control pills." Okay, but then what are the alternatives? So I'm glad that we get to talk about it. So the things that are available, of course, we have a wide variety of birth control pills. Then we also have the NuvaRing, which is a little ring that you put over your cervix. Then we have injections, okay, those are just synthetic progestins, the Depo-Provera. And then, of course, we have IUDs, which are both non-hormonal and hormonal. And the hormonal IUDs, Mirena is by far the most popular one, is again, completely synthetic progestins. So, these synthetic hormones are not good for you. And I think, with the birth control pills, you have a combination of estradiol and some type of synthetic progestin. And the whole idea with the birth control pills is that you kind of even out the hormones so you never have the big LH surge that makes you ovulate. And I don't, there's a lot of low dose estrogen pills, and they use a form of estradiol, so I don't think that's really the problem. I think the problem with all of these different methods are the synthetic progestins. So synthetic progestins are not the same as bioidentical progesterone, and that is really what the big problem is. And so basically, you take these synthetic progestins, then your own progesterone production will go down to essentially zero because, of course, the body wants to keep everything in homeostasis, wants to keep everything with the same levels. And so when you feed it a bunch of synthetic progestins, it stops making progesterone. And these progestins have some progesterone-like actions, but it's not progesterone. And so people have a lot of side effects related to having this product that's not progesterone. So you can get, mood swings, bloating, insomnia, like all the symptoms of a progesterone deficiency.
So why actually are all those pills synthetic hormones, since we also have bioidentical hormones for anti-aging or the older women?
That's a good question. And I honestly don't have an answer to that. I think some of it is probably the preparation, because these synthetic progestins can be very, very long acting. And I don't know that we don't have a formulation like progesterone is progesterone, and so we don't really have a formulation of long acting progesterone. And I'm honestly not completely sure. I don't know if it's not possible to make a long acting progesterone or what it is about these synthetic progestins, but that's what's used.
Okay, maybe that's an idea for a pharmaceutical firm then. Another thing I hear a lot of teenagers already have are those implants. What do you think about that?
Well, yeah, so the implants, those are long-acting synthetic progestins. And yeah, they are just not good for you. And because they really disrupt your own hormone production, and they can also have a lot of side effects related to, both like progesterone excess and progesterone deficiency. And one of the other things that I actually see a lot of, and I had this in myself also, actually, because I took birth control pills when I was younger for about 20 years because I didn't know and I didn't want to have a baby. So, it's a pretty foolproof method of birth control. So, one thing I didn't know at the time is that also all these synthetic hormones will really raise your sex hormone binding globulin. And so, you can feel fine on them when you're younger, although certainly a lot of young women have a lot of side effects from birth control. But then when you get older and you really look at it, you have a very high sex hormone binding globulin, and you already probably have a testosterone deficiency. And then the high sex hormone binding globulin will make the testosterone deficiency even worse because the free testosterone is like nothing. So when I actually first looked at my sex hormone binding globulin, and I took the birth control pills for like 20 years until I was in my late 30s. When I first looked at my sex hormone binding globulin, I guess in my very early 40s, it was 175. And I see that kind of thing all the time. And then I always ask my ladies, hey, did you take birth control when you were younger? And it's always something like either birth control or IVF or some kind of hormones. And so then you have to bring it down. So I bring it down with a DIM detox. You can bring it down. So DIM is a compound that's found in cruciferous vegetables, but you could never eat enough broccoli to get your DIM. So you take it in a capsule and it will bring it down, but it takes a very long time. So after taking DIM for years, like my sex hormone binding globulin is, around 90, which is still probably a little high, but it's a lot better. And I'm not sure exactly what it is about the NuvaRing, but I have seen 3 patients in the last few months that all were on the NuvaRing that had a sex hormone binding globulin over 300. And I have never seen that before. I have only seen it 3 times in my life on these 3 patients that were all on the NuvaRing. And I don't know what it is specifically about that combination of the synthetic progestin that they're using, but it's like it's a problem, and then so you're going to have a lot of problems later on from taking these things long term. And again, these women are complaining of feeling tired, low libido, mood swings, insomnia.
Yeah. So, that was my next question. So there are even long-term health risks from taking years of these synthetic hormones.
100%. And nobody tells you this. And honestly, no offense to, the gynecologists, but basically, when you see a conventional gynecologist for any problem at all, they just try to put you on birth control pills. Whatever it is, they're like, oh, would you like some birth control pills? And, that's not the solution. And again, no offense to gynecologists, it was actually a friend of mine who was a functional gynecologist who actually fixed me when I started to have my own medical problems. And she was amazing. But again, she was practicing functional gynecology. And this was after my conventional gynecologist had totally failed me. And, the best medicine really, I believe, is a combination of conventional and functional medicine. Conventional medicine just misses so many things. And I think, I don't know, when I was a teenager and I started having sex, I told my mother, and she was like, oh my goodness, I don't want you to get pregnant. She took me to the doctor. They put me on birth control pills. I didn't have any side effects, and I just stayed on them. I was in college, medical school, residency, and I definitely didn't want to get pregnant. And it seemed like a good thing to do. And it wasn't until so much later that I realized how bad they were for me. And I wish I could go back and take them out of my body, but obviously that's impossible.
Mm-hmm. So after hearing all that, so what is the best contraceptive method, for women?
Well, this is a tough one, right? So so of course, obviously, you have barrier methods, okay, which are like condoms and whatnot, which are fine for the short term. Like if, and you know, I'm an infectious diseases specialist in my other life, and I run an HIV treatment and prevention clinic, right? So I do actually treat STIs nonstop, and so, I mean, you know, if you're having casual sex, it is a really good idea to use a barrier method, okay? Because you don't know these people and you could easily contract something. And then condoms are a great idea, okay? But for a long-term relationship, condoms are not a great idea, you know, and it's just not really practical. So then what are you left with? So pretty much the only non-hormonal form of contraception that there is would be a copper IUD. So with a copper IUD, sometimes it's fine, but sometimes people have a lot of complications. Some women really don't tolerate it because they just have a ton of bleeding. And this is in contrast to the Mirena, which is a really popular IUD that's full of synthetic progestins. And with the Mirena, you'll actually stop having your period, but you can also gain weight, get bloated, get really moody, all this kind of stuff. But with the copper, if you can tolerate it, I think that's a really good option. But a lot of women have so much bleeding, they just can't tolerate it. And that's really the only thing that is available. So I started doing some research, and I actually found something that I thought was pretty interesting. It's an app, and it's called Natural Cycles. And I didn't know about it, but I found it when I was doing some research for this conversation that we're having. And so the Natural Cycles is an app that actually will tell you whether or not you're ovulating. So basically you download the app and then they send you a thermometer and you check your temperature every day. And then based on your temperature, they will tell you whether or not you could possibly become pregnant. And so if you're in that, if you're in the green area, you could just go ahead and have sex. And if you're in the red area, you either don't have sex or you use some kind of barrier method. Now, again, I think this is great, but it also makes me a little bit nervous because, you know, you could get pregnant, and they say, you know, it's 93% effective on the average. And if you use it perfectly, it's 98% effective, but then how many people really use it perfectly? And especially in America, there's a lot of places right now where access to abortion is really restricted. And so, I mean, if you really don't want to get pregnant, then, you know, you may end up on some birth control pills. And it's, I mean, there's not a great solution. So I think that, I think the copper IUD would be worth a try. And if you don't tolerate it, then, you may have to consider a birth control pill for some length of time. Now, the other thing is that what I say to my couples, so the only reason to ever take a birth control pill is if you absolutely don't want to get pregnant, okay? If you have any other problem at all, you can definitely use a combination of bioidentical hormones, okay? And I see ladies all the time that are on birth control pills for reasons other than birth control, and I get them off immediately, and I give them bioidenticals. And the other thing that I would say is that if you have a couple that is in a stable, long-term monogamous relationship and they are sure that they do not want to have any more children, and they're positive about that, they've had their children, they're done, then at that point, what I recommend is that the man have a vasectomy.
Mm-hmm. Yeah. Good info. Yeah, sure. I wanted to add to that, as a dermatologist, I see a lot of young children, I call them 12, 13 years old girls. They are already on contraceptive pills because their GP, their general practitioner, have put them on those pills to control their acne. Can you believe that? Just to control their acne. So I always try to take them off immediately. I say those pills are not for acne. Those are not to get pregnant. So that's nothing you have to worry about yet, I hope. And so I get them on whatever antibiotics or local treatment or whatever. But birth control pills for acne is just mind blowing.
I agree. Acne, PCOS, mood swings, heavy periods, like all this stuff. And you can treat all those things in a much better way with either bioidentical hormones or, like you said, something else, like a topical antibiotic for acne, fixing the diet, all this kind of stuff. Yeah, birth control pills are just they're just not the answer to everything. And the vasectomy thing, you know, I mean, I don't know if I don't know you men out there, I don't know if you want to hear this or not, but a vasectomy, it's such an easy, straightforward operation. My ex-husband actually had a vasectomy, and I actually watched the whole surgery because a friend of mine did it, and it's a tiny bit of local anesthesia. It takes about 5 minutes, and then you lay on the couch with a bag of frozen peas on your scrotum for 1 day, and then you just go back to your normal life. Like when my ex-husband had his vasectomy, we were training for a marathon at the time. He missed one training run, one, and he just totally went back to his normal life. Whereas if a woman has a tubal ligation, I mean, that's surgery, you know, that's an invasive surgery. So I think that the vasectomies are really underrated. Mm-hmm.
Yeah, I think so too. Yeah. Another thing I wanted to ask about the hormonal intrauterine system or device. I remember my wife's gynecologist telling her that with an hormonal intra-UD, the hormone stays locally in the uterus. It doesn't come into the blood, so you don't have these side effects and whatever. But that's wrong, right?
That's totally wrong. You really can't give hormones locally. I mean, they go into the bloodstream, and you can. I mean, you can put, you know, like an estrogen gel in the vagina, but I mean, everything gets absorbed, right? And with an IUD, absolutely, there's systemic absorption. How could it possibly stay in the uterus? I mean, you have systemic absorption, and you know, I see people all the time that have IUDs that have tons and tons of side effects.
Yeah, especially acne from this Mirena. Yeah, I see it all the time.
Yeah, acne, weight gain, bloating, insomnia. It's definitely not localized at all.
Exactly. I don't know why the gynecologist even tells women that, but yeah, I think it's to reassure them that it's better than taking pills, but I don't know.
Yeah, I don't think so. I mean, I think it's pretty comparable. I mean, you don't get the estrogen, but you know, a lot of the pills are so low dose estrogen. I don't think the estrogen is the problem. I think it's the synthetic progestins.
Mm-hmm. Yeah. I also guess most gynecologists don't want to put a copper IUD into young girls that haven't gotten pregnant yet. I think that's a big problem. So, is that the same with you there?
I'm not sure. I think you can get a copper. I'm not sure, but I think you can get a copper IUD when you're young.
Mm-hmm. Yeah, I was even taught here in my lessons 20 years ago that they don't do it because of the risk of intrauterine infection. And if those teenagers get that, they wouldn't ever be able to get pregnant. So to eliminate that risk, they wouldn't put an IUD in women that didn't get pregnant or don't have children.
Yeah, no, they definitely put IUDs in young women that that haven't gotten pregnant, and you can get a copper. I think just that the Mirena, I think just was a lot more heavily marketed, and the Mirena, and also because it will stop you from having your period. And so, you know, if you don't know anything about this, it sounds great, right? Oh, we're just going to put this in, you know, you're not going to get pregnant, you're not going to get your period. Okay, cool, sign me up.
Yeah, right.
Again, try the copper IUD. If you're in a long-term relationship and you're not going to have kids, talk to your husband about a vasectomy. And if you're not in a relationship at all, use barrier methods so you can protect yourself from sexually transmitted infections. And I mean, I don't know that taking birth control pills for a few years is really the end of the world, but you want to try to keep it to a minimum, and you should only use it to not get pregnant. For any other reason, we have other better things.
Exactly. Awesome conclusion. Thank you so much, Amy.
Thank you so much for having me.